Hey, good morning, everybody. Thanks for tuning into the Capitalist Cast today. Today we're joined by Zach Shamberg from the Pennsylvania Healthcare Association. We're going to talk about the Wolf administration's handling of the COVID-19 crisis as it relates to nursing homes and other care facilities. But first, Zach, would you tell us a little bit about the PHCA?
Yeah, of course, Leo. Thank you so much for having me, and thanks for the opportunity today. The Pennsylvania Healthcare Association, or PHCA, is a statewide advocacy organization. We're located in Harrisburg, just 2 blocks from the Capitol, and we represent long-term care in Pennsylvania. So that's nursing homes, that's personal care homes, and that's assisted living communities. We represent not only the providers themselves, but also the frontline workers, our healthcare heroes, as well as, most importantly, the vulnerable residents they serve, Pennsylvania seniors. And at the end of the day, we are really, as an association, the conduit between those on the front lines, those providers, workers, and residents, and our elected officials in state government. And I have to tell you, I don't know a time when our role was more important than it's been over the past year and dealing with and combating the COVID-19 pandemic.
Yeah, and I think that's a really great kind of segue into what we're going to talk about, because when we look at reflecting back on a little over a year, what we saw was when you look at the data, the impact of COVID-19 was incredibly lopsided towards people who are over a certain age with different healthcare conditions. So I mean, that was really clear from the outset. So when the Wolf administration, the Department of Health, and things started really moving in Pennsylvania, what was the reach out? What was your relationship with the Wolf administration as they were formulating what their plan was?
Yeah, it's a great question. And first, I want to address your point, because it's a point well taken, that long-term care since day one of the COVID-19 pandemic has been the epicenter. And even going back to February and late February 2020, where we saw the first confirmed cases of COVID-19 in the United States occur in a nursing home in Washington State. And the first thing that we did as a state association here in Pennsylvania was reach out to our counterparts in Washington State after seeing what was happening there. And the question that we asked was, if this makes its way to Pennsylvania, which it's likely to do, what do we need to be ready for? And some of the things that they shared with us are really interesting, or were really interesting. And in fact, there's still battles that we are fighting today. Prioritization when it comes to PPE, or personal protective equipment. Prioritization for testing supplies, prioritization for staffing support, all the things that we would need to try to combat the COVID-19 pandemic for those who are most susceptible and most vulnerable to the virus. Now, in mid-March, the first letter that we wrote as an association to the Wolf administration asked for some regulatory waivers and flexibilities as it relates to staffing. Because again, Washington State told us very clearly that we were going to have a problem staffing our facilities. And I'm proud to tell you that 3 of the 4 asks that we made were accepted. But that's really where it stops in terms of that collaboration. And I think it's a very important point that I hope that we'll touch on more and more during our conversation. And that's the idea that for those providers on the front lines, and for a conduit like me and like our association, there needs to be a level of collaboration, because we can share experiences, we can share challenges, and most importantly, we can share opportunities and solutions as it relates to the response. And unfortunately, we spent many, many months of this pandemic fighting for that seat at the table.
Yeah, and you raise a really good point about the collaboration. I'm assuming when the Wolf administration decided to have, COVID, people who had tested positive for COVID and were at a hospital, transferred back into a care facility. That was not something that was done in collaboration with the care association.
Well, no, and in fact, this was something that we warned against because we were hearing about it and seeing it occur in other states. And I think, as you know, and as your viewers know, only 5 states throughout the country instituted a policy like that. And we were very, very clear, knowing what we knew about our vulnerable population and knowing how quickly the virus could spread in a contained area like a nursing home. We made it very, very clear to our elected officials and our state leaders that this was not a good policy if we were trying to protect our vulnerable population. Look, other states did it, and I'll use New York as an example, because they were trying to preserve hospital space given their fear that there wouldn't be hospital beds available. But in Pennsylvania, we didn't have that experience. Outside of the city of Philadelphia, there were no hospitals that were overflowing or that were worried about or truly worried about those hospital beds. We didn't need to enact a policy for that. And in fact, if you look back at the beginning of the pandemic, even in the city of Philadelphia, we were setting up potential areas for COVID residents or COVID patients so that we didn't have to bring them to a nursing home or a long-term care facility, yet we still enacted that policy anyway. It didn't make sense then. It doesn't make sense now.
Yeah, and in the true fashion of passing the buck, the Wolf administration, in making that decision and in continuing to defend that decision, points to the Centers for Disease Control and their guidance. And if I'm not mistaken, what the Center for Disease Control said is that you can take these patients back, and in contrast, what the Department of Health and the Wolf administration said was essentially you will take these patients back. So it sounds like it's a minor difference, but can you explain like what practically that means?
Yeah, it's a very minor difference, but I would go back, and it's hard to do this now, but I would go back to March 18th, 2020. And really, this is the height of the pandemic, or the beginning of the height of the pandemic, when the surge is starting to occur in Pennsylvania, and providers are learning, they're scrambling to keep people safe, they're looking for staff, they're looking for PPE, and then we receive this guidance, which eventually becomes a mandate. And unfortunately, we're still debating it today. But really what it said was that it made the change from the federal requirements or guidance that you would need to, as a provider, accept a COVID positive resident. You couldn't turn someone away. The important thing to note, and what we told our members throughout the state, is that if you don't have the necessary personal protective equipment, if you don't have testing, if you don't have staff available, and if you can't cohort, or in other words, create COVID specific floors or wings, then you can't do this because you're putting lives at risk. And unfortunately, the guidance that we received didn't really spell that out. So there was a lot of confusion. And Leo, I think it's important to note, at PHCA, we represent 200 nursing homes and 200 assisted living communities and personal care homes. We do not represent every facility throughout Pennsylvania. So while we were clear with our members, I can't speak for those who we don't represent, and I don't know what happened there. And that's really unfortunate. There could have been that confusion.
Yeah, and I think that brings up a good point, because you're a voluntary association. If a long-term care facility or an assisted living facility wants to join, then they join, and they have kind of the benefit of that shared knowledge. Whereas they're obviously, I don't want to say independent, because most of them are independent anyways, but there are, different homes that aren't necessarily benefiting from what you guys are able to do in terms of pooling knowledge. And the fact that the guidance that was coming out from the Department of Health was just really woefully inadequate, it really has to make everybody's life a lot harder. Because so what would happen, just as a for instance, if one of your association members or any long-term care facility gets a call from a hospital that says, we're going to be discharging this John Doe who came in, he tested positive for COVID. He doesn't need to be in the hospital anymore for his care. He's still positive. We're discharging him to you. If a facility were to say to, the Department of Health, or to say to that hospital, we can't accept this person back because it's a risk to our population, what happens next?
Well, that's where that guidance really comes into play. And what I will tell you is, anecdotally throughout the state, there was a lot of talk early on in the pandemic that this guidance really did give hospital systems throughout Pennsylvania the ability to really put pressure on a lot of nursing homes, even assisted living communities and personal care homes, that they should accept COVID positive residents, again, to make room for what could be a surge in hospitals. And I would actually go a different direction with the guidance as well. I mean, we were at a point, not just with this COVID mandate guidance on March 18th, but we were at a point where new guidance was being updated both from state and federal government on an almost daily basis, sometimes twice a day. And where some guidance could have fallen short, I mean, there was such an overabundance of information and directives that for the providers on the front lines, it was really hard to keep track of everything. And Leo, again, I think it's important for your viewers to know, we represent long-term care, which is the second most regulated industry in the entire United States. We have administrators who can't sneeze unless it's written in the regulations. And tomorrow, we're going to be testifying before the House Majority Policy Committee on some of the regulations that were waived, some of the flexibilities that were given. And essentially, we're going to argue for the point that if we didn't need the regulations last year, that we really need them going forward. And I think that's an important point to make when we look back at the year that was.
Yeah, and I think that's I would have to agree with you, because there are a lot of regulations, and not just as it relates to long-term care, but really all over the regulatory environment that were waived, and we clearly we didn't see any adverse reactions or adverse events because of it. So it definitely brings up the question, are some of these regulations there just to give an inspector something to look at, or are they really functional? Are they doing something to keep people safe, or is some of this just busy work?
Yeah, that's exactly right. And I'll give you a really good, quick example. One of the first things that we asked for from the Wolf administration was the ability to pull frontline workers from another state, maybe a state that wasn't experiencing the COVID surge like we were, and have them immediately come to Pennsylvania and serve on the front lines with us in nursing homes, assisted living, and personal care. Now, normally, to go through that kind of process and to jump through all of the regulatory hoops, that could potentially take months. And we were able to get that done very quickly. A workforce shortage or a workforce crisis is something that this sector has dealt with for the better part of the last 10 years, and no more so than throughout the past 12 months. So it's a regulation like that if we can do away or disband any kind of barriers to supplement our workforce and to bring people back to the long-term care workforce, that's going to be really important and beneficial moving forward.
Yeah, and that's a great point. A lot of times the regulations that are in place, if someone is licensed in another state or is eligible, and it's basically the same requirements, there's really no need, other than the state government wanting to collect a fee from someone, to have them go through the entire process all over again. So the idea of reciprocity is vitally important. But before we get into some of the regulatory changes that you want to see going forward, I want to touch on what's happened through the vaccine rollout. How has that gone for you guys? Has the Department of Health been more collaborative? Have you gotten how have things how have things been working, through that process for the long-term care and assisted living facilities?
Yeah, it's a great question and a really important topic to address. I would tell your viewers that as we were preparing for the vaccine rollout in long-term care, again, knowing what we knew about this virus and who it had impacted more than any other segment of the population, we knew that was our most vulnerable in long-term care, whether it's a nursing home, personal care home, or assisted living community. Pennsylvania first received the vaccine on Monday, December 14th, yet not a single long-term care resident or staff member received it until a full 2 weeks later, Monday, December 28th. And frankly, a program, the Federal Pharmacy Partnership Program, that should have probably lasted maybe 2 months, took 102 days to complete. So we had nursing home residents and workers throughout the state, assisted living communities and personal care home and their workers and their residents waiting weeks, if not months, for their doses of the vaccine. And again, I would just go back to the point that knowing what we knew by mid-December, I have to ask the question. We asked it many times, whether it was in letters, on social media, with our members, and in legislative hearings. Knowing what we knew, why was long-term care not prioritized? And I think that you're hopefully sensing a theme here, that as we talk about collaboration and as we talk about a response to the pandemic, we fought and we have fought throughout the last year for prioritization when it comes to relief efforts and support for our most vulnerable.
Yeah, and it's really unfortunate. And as I mentioned to you before, before we came on air, that this really seems to be a very consistent theme between everyone we talk to and the Wolf administration. There really seems to be a very much a go it alone approach to how they handled the COVID-19 situation. I mean, outside of collaborating with, states like New York and New Jersey and some other places who really didn't handle things very well either, we didn't see a lot of communication between the Pennsylvania state government, the decision makers, and the industries that were affected, whether that's long-term care homes, whether that's the restaurants, whether that's manufacturers. There was just really it was a very top-down approach where, from the outside looking at it, it seems that the governor and his team just decided, we know what's best, this is what we're going to do, and everybody is just going to have to go along with our plan. I don't want to be unfair, but that just looking at it, that's what seems like it was. Do you have the same impression?
Well, I can't, it's hard for me to speak to the restaurants and the other industries, right, but I'll tell you what our experience was. And, what's frustrating about this is, again, I'd go back to the first letter that we wrote the Wolf administration that asked for those regulatory flexibilities. And that was based on the experience that we were seeing already and what we were hearing from our counterparts in Washington state. 3 of the 4 regulations that we asked to be waived were in fact waived. And that yielded real benefits, not just to our workers and providers, but ultimately to the residents themselves. I would even go back to the Trump administration and CMS Administrator Seema Verma. Her motto was always patience over paperwork. And that's right. That's what we tried to get at with some of those asks and those flexibilities and those waivers. And when we worked together, Leo, again, that yielded results. That yielded better care. That yielded real benefits. So why not continue to do that moving forward? And like I said, throughout the past 12 months, we have fought for collaboration. We fought for a seat at the table. And when we get one, and when we're able to collaborate, everybody benefits. So we should do that moving forward, and not just in long-term care, but with every advocacy organization, every industry that's vital to Pennsylvania out there. I think it's a really, really important lesson.
Yeah, and one of the folks who commented on Facebook actually brought up something about when are people going to be held accountable? And I know in watching all of this unfold, it was really disappointing. The Attorney General Josh Shapiro, announced months ago that he was going to be investigating what happened as it related to long-term care homes and nursing homes and assisted living facilities. But he from the outset said, that his investigation would not look at state officials, the decisions made by state officials. He would only be looking at the decisions that were made by the care homes and the like. What kind of message does that send? Is that something that that your members find frustrating, or how does that impact what you are looking at going forward?
Well, I think I could speak for our members and really the entire industry, not just across the state, but really throughout the country, when I say it doesn't benefit anyone to just play the blame game. And unfortunately, we've heard that, whether it's from the administration, whether it's from members of the legislature, whether it's from the attorney general. And just on Friday, we heard it from the Biden administration that there are problems in long-term care, and that's where we're going to stop. I think that we need to collaborate. We need to work together. If there are inherent problems, if there are systemic flaws in long-term care, which we know that there are, we know that there is a Medicaid system that is woefully underfunded. We know there's a workforce crisis. We know that there is a terrible legal climate, and we know that there's a burdensome regulatory climate. Instead of just pointing fingers and saying that there are problems, we need to work together to fix those problems. Because if we just point fingers, then again, you know who we're failing? We're failing our most vulnerable residents. And in the third oldest state in the entire country, where we need a robust long-term care continuum, we can't afford to do that. We need to work together. We need to lift up the system.
Yeah, and I think that's a great segue into what do you want to see happen from here? I know that you're going to be, as you mentioned, testifying before the House Majority Policy Committee about that. But what are some steps? What are some of the things that you and your members have learned through this process that you could see benefiting the folks who are at these facilities in a normal environment, but also, God forbid something like this should happen again in the future? What are some of the changes that you would like to see happen? What are some of the lessons that you all have learned?
Well, and hopefully we are working towards that normal environment, and we'll be back to normal or a new normal, whatever that is, not just in long-term care, but throughout the state. But, Leo, as I look at the last 12 months and I try to think about what we've learned and what we'd like to do moving forward, I think you have to go even further back. And again, for the better part of the last decade, we have warned about this system and our need to invest in this system, whether it's through the state's Medicaid program, which pays for more than 70% of all care provided in nursing homes, whether it's addressing that burdensome regulatory climate, our truly terrible legal climate that has literally forced providers from this state because they are facing a barrage of lawsuits, or the workforce crisis and not being able to adequately staff buildings or bring in enough caregivers to care for our aging population. We need to look back because the last 12 months amplified and exacerbated those issues. It's no surprise that this happened. It's no surprise that long-term care was the epicenter, given those systemic challenges. So we need to look at not just the last year, but probably the previous 7 to 10 years, come together with elected leaders, with the Wolf administration, with the Attorney General and others, and say, what do we need to do to ensure that we can care for our residents and provide high quality care moving forward? It is time to invest in this system. It's time to address the challenges that have plagued this system for the better part of the last 10 years. And I'm ready to do that. And I hope to be brought to the table for it.
Yeah. And so I know specifically as it relates to the workforce challenges, you had mentioned, the some reciprocity type of arrangements with other states. How do you think that? Well, beyond that, when we're looking at the changes that need to be made, I know Pennsylvania is one of the most hostile environments as it relates to lawsuit abuse. We're frequently in the top 10, top 5 worst states in the country. What types of changes, when we look at those types of issues, would be helpful?
Yeah, well, we've been number 2 in the country in terms of the terrible legal climate for the last few years. And in fact, and I hope I can say this on your show, but I believe Pennsylvania and Philadelphia were just ranked as the number 1 and 2 judicial hellholes in the entire country. So yeah, I don't know that it's ever good to be called or referred to as a hellhole, but let alone being number 1 in the country. That's not a good thing. That's not something we put on a billboard when you're coming across the border from Maryland or from New Jersey. So we need to address that. We've worked for the last 5 years on real tort reform initiatives and real lawsuit abuse initiatives. And one thing that I'll add is that there was a bill that went through the legislature late last year. It was vetoed by the governor. It was just approved by the House, I believe, 2 weeks ago. And that's simple liability protections, targeted liability protections for all industries and schools, restaurants, long-term care facilities, hospitals. It's protections against COVID-19 related lawsuits. And it puts a standard on those lawsuits so that we're not seeing the opportunistic attorneys from out of state who are coming to Pennsylvania to try to file lawsuits and really sue industries out of existence. And that includes long-term care. It's things like that countless other states have done that we can enact in Pennsylvania very simply. That's going to protect business. It's going to protect jobs. It's going to protect care moving forward.
So, and that's actually a great piece of legislation. And since that, it's now moved over the Senate. Can you talk a little bit about what exactly the liability reform as it relates to COVID would do, how it would impact, not only to protect, the businesses, but also what it does for folks who would be seeking, to file a lawsuit if something bad did happen?
Yeah, and basically what the law does, or what the bill does, it puts a standard of gross negligence on any COVID-19 related lawsuit. So you'd have to prove that or above for the lawsuit to continue. And again, what that will do is limit the opportunistic or frivolous lawsuits that we can expect to be filed over the course of the next year. And I'll give you a great example, Leo. We're hearing from members all across the state. It doesn't matter what their geographic region is, that we have attorneys from both Pennsylvania and from other states who are contacting workers on Facebook Messenger, on Twitter, on Instagram, through newspapers and television ads. And they're saying, was there COVID-19 in your facility? Call us. And that's all it takes. That's all you need to do. I would expect the same thing if we don't pass this legislation. I would expect the same thing for every restaurant, for every hotel, for every industry, manufacturers, for schools. And we are going to get to a place here in the Commonwealth where it's just not worth it to do business anymore. I told you that we had good Pennsylvania providers literally pick up and leave this state because of the legal climate. We can't allow that to happen, especially post COVID-19 pandemic.
Yeah, and just to clarify, gross negligence, most people have kind of a common understanding of it, but that is a legal standard. So essentially, if I understand it correctly, a gross negligence in this case would basically be if a provider or a business or whatever looked at the guidance that was issued by the CDC and the Department of Health and said, we're not going to do any of those things. That's essentially what gross negligence would be. Whereas if they were to look at the guidance from the Department of Health and the CDC, and they enacted that guidance to the best of their ability, then they would be protected from frivolous lawsuits, because they actually not just made an effort, they didn't just paper over it, but they were really taking the precautions that were necessary in order to protect people as best they knew how.
Yeah, that's exactly right. And you actually bring up a great point that's contained in the bill, that if you don't follow that COVID-19 guidance that was set forth during the disaster declaration, right off the bat, you don't qualify. And that goes for all businesses and industries. It's a very important point to make.
Yeah, and because it's necessary for folks to understand that there are bad actors. There are people, and there are people who are ignoring, some of this, all of the safety guidance. And if that is a decision that a business makes, then there would be consequences under, this particular piece of legislation. But really what it does is it creates a system for people who did the best that they could, and really did work to implement that guidance to make sure that their customers and patients were safe, and it protects them from ambulance chasers, for lack of a better or a more politically correct term. So
yeah, that's exactly right. And you bring up a good point, and that's that there are bad actors in every industry throughout the state, throughout the country. I'm not looking, and we're not looking to protect those bad actors. If you did something wrong, then you deserve your day in court. What we're looking to do is protect those providers, those facilities, those workers, those residents, those businesses throughout the state that followed guidance, that followed these directives, that did everything right, that didn't get the support necessarily that they needed from the state, but they still could face these opportunistic lawsuits. That's not right.
Yeah. And I think that that's a great place to leave it. We're a little over our 30 minutes. I know that you are a busy man. You have a lot of stuff going on. I know that our viewers really appreciate the time that you took coming on today and kind of going through this and laying this out. Thank you very much for your time. I know I appreciate it a lot.
No, thank you for the opportunity, and thanks to everyone for tuning in.